module. So we've chosen Rachel, the netball player, as our case study. So to summarize kind of the case study, Rachel's parents actually came forward with the case study. And Rachel is 10 years old. She's a netball player at the highest level for her age. And she has been struggling with stuff like anxiety before she plays. And their parents try to talk to her about it, but she doesn't seem to be communicating much or engaging much with them. She's fairly ambivalent towards the game of netball, and she does say she gets nervous and that she likes it when the game is over with, but she doesn't like when people shout at her for making mistakes, and she wants to get rid of the ball as quickly as possible so that pressure isn't on her. So she does say that she is pleased that she's participated in training and games and stuff like that, but also again feels that strong sense of relief when it's over. And finally, Rachel has asked us to keep this consultancy private and avoid disclosing information with the parents. So I think, Tom, you've got a few things to say about the ethical considerations we've took on board.
Yeah, so ethics was very much kind of the first step that we took, first kind of considerations we made, and then everything was sort of built on top of that. Obviously, to begin practicing ethically, we have to be fully qualified. That can obviously be achieved a number of different ways. There's sort of three primary pathways to achieve that protected title of sports psychologist. So you've got the BPS route, the professional doctor route, and the basis route. Before even getting started on any of the pathways, you need to complete a BPS accredited master's degree in sports psychology, which will sort of act as the foundation of specialised knowledge. Once that's completed, then you go into kind of the pathway selection process. They typically take around kind of 2 to 4 years, each one with a slightly different timeline. The BPS stage 2 is an independent route involving a minimum of 2 years of structured supervised practice and assessments. Professional doctorate, that integrates kind of further coursework, research and supervised practice, typically around 3 years, and on completion also allows the protected title of doctor. And finally, the basis pathway, which is another HCPC approved training route, involves a program of professional development and supervised practice, which can take between 2 and 4 years. It's a kind of done as a minimum of 3,200 hours of practice. Once one of those has been completed, you can then apply for registration with the HCPC, which allows you to use the protected title of sports and exercise psychologist. And then ethically, you can begin to practice. Keegan, in 2016, in his book, described ethics as the foundation of any psychological practice. Therefore, our priority was to ensure that our approach aligns with ethical standards set by the BPS and the HCPC. Our first step was to carefully consider which ethical concerns may arise in this case. The kind of first one that jumped out to all of us as a group was Rachel's age. With her being just 10 years old, we have to take extra precaution in comparison to if we're dealing with an adult athlete. It can raise issues around confidentiality, informed consent, managing multiple relationships, dual relationships, and avoiding expectation as well. As she was brought to the session by her parents, that can be quite problematic because the parents will understandably be interested in the process and how she's getting on and sort of what we're talking about and etc. She does specifically state in the case study that she wants to keep the consultancy completely private. So it's obviously very important that we respect that choice within reason and as much as we can. We have to make Rachel and her parents fully aware of our attitude towards confidentiality and kind of how much we will be discussing about the process. So we'll inform them that we won't be sharing any information or conversations that we have had with Rachel with her parents or anyone else, that let's say coach, etc. However, if we believe that sharing kind of a conversation could prevent harm to either herself or somebody else, then it's our kind of duty to ensure that we share that with the necessary parties and only the necessary parties, and to try and do it in the most ethical way possible, where it's, trying to keep on top of that confidentiality still. This clarification has to be done before the process begins. Therefore, it should prevent any confusion or disruption later on in the process. Dual relationships may be particularly problematic with younger athletes as well, as it could easily slip into that kind of parent consultant role. It's important to maintain a strict consultant role in this case, as slipping from this may be harmful to the process by compromising objectivity and professionalism. It could also be easy to slip into a coach practitioner role. That can be dangerous as well, because as seen from the case study initial conversations, it seems she's fairly ambivalent towards netball at the moment. She's not after an improvement in her performance. It seems more that she's interested in kind of bringing back the well-being and the enjoyment of playing netball. Whereas a coach, they're quite likely to prioritise the performance. Obviously, that's kind of their job. So slipping into that dual role could also be very problematic. Leading questions were also something which we spoke about. Using leading questions can be damaging, as it can influence the answers given, as found by Loftus and Palmer in 1974. Even small changes to language that we use could have significant impact on our conversations and can lead to influence her experience as well as her answers. Therefore, that could obviously lead to a lot of harm and lead to us making assumptions about her or conclusions which aren't necessarily true, influencing obviously also our needs analysis and therefore our kind of practice as a whole. So yeah, I think in terms of kind of looking back on it and how it all went, ethics is obviously very important for the protection of the client, but one thing which I think we discussed as well was it's very important not only for our personal credibility and reputation that we stay on top of the ethical side, but also the reputation and credibility of sports psychology as a whole. As sports psychology is kind of still quite an early practice, its reputation is still quite, I suppose, vulnerable and needs to therefore be treated with caution. So that's kind of the first thoughts. I don't know if anyone else had anything to.
Yeah, I mean, on the back of that, I think one thing that we discussed in relation to the ethics was, which then influenced the philosophy that we later chose, was around competence and, as you say, protecting ourselves, but also making sure that what we're delivering is effective and our practice is actually meets the aims that we want to meet and that the client wants to meet as well. So that's kind of how we started generating the discussion about philosophy. It's what we sort of aim for, what the client aims for, how we are as a practice, what sort of rules and boundaries we have. Like, for example, we talked about well-being within the ethics and how does that influence us? Well, in the end, we decided to go with this sort of positivist, constructivist approach to our philosophy. The first part of that is based on us as early practitioners or aspiring practitioners, should I say. Our only experience with sports psychology practice at the moment is literally just through studies, so through university level, undergraduate, and even this master's course. So everything we base ourselves on, like all our theories and how we aim to do everything, is very scientifically backed and evidence based. And especially with someone so young, mentioning back to the ethics, we want to make sure that what we're doing, has some validity to it. We're getting that from somewhere. We're not just doing things that we can't really have faith in and that the client can't have faith in as well. But also this particular case study presented with some sensitive topics, working with this young and vulnerable person. So in addition to this positive philosophy that we have naturally, we kind of felt that constructivism was something really key to tying everything together, to make sure that if there's anything that the literature is missing, that this client mentions it, especially someone so young who from the case study seems to not be able to speak up as much for herself. We want to have a person that she can speak up with, and so bringing in this constructivist philosophy allows us to fill any gaps that positivist philosophy might not be able to reach. Also makes them more comfortable and more trusting of us. So altogether, this entire blend of positivism, constructivism, we thought would work really well, and I think that kind of ties into how we then went on to the needs analysis as well, because it equipped us with the right ideology to kind of comprehensively and accurately work with this case study and help them achieve their desired goals.
Yeah, I think it's also probably good to note that they're very different. Like with the ethics, we sort of just agreed that was what we were doing. There was no sort of like disagreement within that, because we all knew as sports psychologists anyway that was the route you got to go down. These are the things you've got to follow. And it's very sort of like, it's very simple and understanding. No one really fell out on views of that. Where I think with the philosophy, I think some of us might have had a few different opinions. I know me and Tom had a few slightly different opinions, and it was at one point we were so set on we're going down that philosophy, and we all gave our points, and we said, "Oh no, we were on that philosophy." And I think it took us a while to actually realise that we were all probably saying the same thing, yet we just hadn't properly defined it, and we didn't know that was, the constructivism, positivism philosophy. So I think it's a good thing to note that, yes, even though we ended up deciding that, there was still some like disagreement with it, and I think it sort of then it probably helped us because it helped us narrow down with that. And then, like I say, once we narrowed down our philosophy, it sort of just took on from there. We knew we would be able to then move on to the needs analysis, and the needs analysis literally is just collecting the needs of the client and collecting what they're asking from us. So analysing her strengths and weaknesses, and using that to sort of create this case formulation. And I think it was important as well for us to note that this is a 10-year-old girl. It's not someone that we can just throw loads of scientific terminology at. We've really got to tailor our language, like speaking to when we engage with her. So we thought, how can we best approach that? And we thought, well, a semi-structured interview is probably the best way to sort of tailor our questions towards her, because research has shown, and Miriam and Tisdall said in 2015 that semi-structured interviews the most flexible forms of qualitative data. So you have your questions, and then you can sort of add like prompted questions, which was probably really useful for us, because it might have taken her a few times to get used to it, a bit like icebreakers. So even like thrown off guard by saying, like, how would you what's your opinion on this? Nothing to do with her actual feelings, and it sort of helped her open up. And then she said she's not the most talkative person. She said she's shy. So I thought this was probably the best approach for her. And then what we did is we took the answers from the interview and put it into this psychosocial existential 5P model. It sounds very very scientific, but all it is the 5P model just allowed us to gain a holistic and structured understanding of her needs. It's literally putting it in like a mind map, effectively. So the 5Ps were presenting, so what was happening now for her, predisposing, what made her feel vulnerable, precipitating, so what triggered her emotions recently, perpetuating, so what keeps her emotions going, and lastly, protective, so what keeps her cope, or what helps her cope, I should say. And when combining this with then the biological, psychological, social, and all these existential factors, we can see how they all sort of interact with each other. So let's say if it was a biological emotion that was presenting, it would be she's not feeling well, and she said in what we got in case study that her tummy was hurting. So just by mapping it there, we can really extract all that information from that tiny case study, and then from speaking to her with limited detail that she might give us, really extract that so we can build a good enough case formulation. And this model was consistent with our philosophy throughout. We were trying to make sure that was the case. So obviously, it doesn't just provide us with what's happening to the athlete, which would be the positive aspect of it, but it also incorporates how Rachel experiences and understands what's happening, which would be the sort of constructive element. And we also decided to do some questionnaires. So we had, once we'd got the interviews, we'd sort of get questionnaires, just ask her small things as well. And we did that by doing sport anxiety scale, a 2v2 achievement goal questionnaire, and a revised sport motivation scale. The reasons for these questionnaires, because they have statements within the inventory which relate to the case study itself, and relates to what she's struggling with. And then from that, we can quantify her behaviour and cognitions towards the sport. So, like I said, we're a constructivism, positivism. So the use of questionnaires and the semi-structured interview sort of allowed us to extract all that information, and it just helped to keep it measurable and reliable.
Yeah. Sorry, I wanted to add something there because that's a good point you made. I think tying it from the philosophy and even to the case formulation that we did after, while we did give it maybe some thought as to what philosophy affects what we should pick, I think more so it was the other way. I think from our conversation, really, we sat down and we said, okay, us as aspiring practitioners, how would we go about getting the most information to be able to build this case formulation? So instead of going, all right, well, we're constructive positivists, let's have a look for stuff online that fits that role, we kind of just sat there and, because that's what you said before as well, we kind of went back and forth picking what it's not really picking, we just found out actually that we fit into this category a little bit more.
Categorization more with the philosophy rather than
action. So we're not really picking, we're just kind of, as we're now doing this needs analysis and looking at the case formulation in a second as well, we just kind of realized, okay, well, we fit into this kind of category more.
And I think it was good. I think one of the reasons we wanted to do that sort of like mixed method, sort of doing the questionnaires and the interviews, is to sort of just, it helps her understand as well as us, because we can simplify it, because we've got all this different data, and we can just combine the quotes that she said from the interviews with, effectively the stats from her questionnaire. So it's not just her, let's say we just did the questionnaire. It's not just us saying, well, you actually scored this level of whatever, because she's not going to understand that. We might understand that, but the whole point is we're helping her. So we want to be as open and honest with her. So again, being transparent with her, because her parents might even want to ask like the question. She might go, well, what did she do? Like, what did she speak about? And obviously, I know that touches upon some of the ethical dilemmas, and that's something we'd speak about as well. So it's not like we just go and openly say it. But if Rachel was okay with stuff, again, simplifying it for us was good for the case formulation. I think that was one thing we wanted to touch upon the most at the end of doing that.
Every bit of information that we do gather through our needs analysis is going to shape the case formulation. So, like, obviously, our philosophy, the ethics, all that information from the needs analysis is going to shape us. And I think when we started looking at it, the approach of using the ACT model, which is the acceptance and commitment therapy model, I think we found to be the most appropriate. Because ACT kind of it's flexible in its approach. It's based on 6 core principles, which are obviously like acceptance, cognitive diffusion, contact with the present moment, selfless context, values, and committed action. But it's not set in that order. You can very much make decisions about what processes you use, what to target, and what order to target them in. So again, that's being able to use Rachel's voice to go, what do you want to target first? What do you think is most important for you? And what's working, what's not working? And it gives you that flexibility in doing the intervention. Just kind of what motivates her, what she's buying into the most. And of course, we're always going to be guided by relevant literature that has proven basis in providing results in like real world environments. And one case in particular, which was Hartley's 2020, he used ACT methods in his work with elite youth athletes. The main kind of objective of ACT is not to change the frequency of like your thoughts, your feelings, your emotions, but rather to kind of change your relationship with them. So it affords you the flexibility to start and to revisit therapeutic processes, where and when is needed. The starting point again will be guided from our needs analysis, what we find out in these interviews, in our chats with her, building up our rapport so that she feels more comfortable to open up to us as well. So like in Rachel's case, the way we could apply the ACT core principles to her kind of case study is like with acceptance. We could have Rachel just like accept the kind of those pains in her stomach, those butterflies, rather than trying to eliminate them, just kind of help her to accept them as normal. And it's just kind of an indication of the body readying itself for action, for training, for matches, and it's just normal. For cognitive diffusion, you can teach Rachel to kind of see her thoughts as like passing words and they're not the truths of what she's actually feeling in that moment, getting her more comfortable with those emotions. For contact with the present moments, just simple grounding techniques like feeling your feet on the floor, taking a breath. All of these things can be done before, during breaks in the match, during half times. Like they can all be done throughout the trainings, through matches. Seeing herself as context, or rather than seeing herself as just performances and the outcomes, and she's more than just her successes or her mistakes. And seeing what her values are, what at this moment matters most to her. Is it the enjoyment? Is it the performance? And then for committed action, just like setting small value-driven goals, reinforce effort and courage rather than just the outcome. Another thing that we're thinking of is like having a post-intervention questionnaire, or even during the intervention, to kind of see where she feels she's strong, where she feels she's growing, where she feel maybe she needs to target more, and kind of being able to judge our intervention through those answers as well. Like there's not a lot of work with ACT with elite youth athletes, which Rachel is, given her age and her abilities and the level that she's playing at. There is ACT obviously models for older athletes, but Hartley's was the most like real process driven, results driven in the real environment. So I thought that was the best study and the best kind of approach to taking this model for this.
Yeah. Just one last thing to add there as well. I think we thought about doing psychological skills training, but the thing was, as we mentioned in the ethics and the philosophy, our main focus was mental well-being rather than elite performance. So we kind of went down this route to ensure that even if she does stay in sport, or if she doesn't, that she's getting the best care from us that we could possibly provide. Yeah.
And then that, of course, just reflections overall. Then Abdullah.
So getting on to the reflections. So reflections are the challenges that what we have faced as a group, and the lessons what we have learned as a learner or as a practitioner. So as a group, working to a Rachel case study was a challenging one, but a valuable experience too. As a sports exercise practitioner or as new to this case study, this really pushed us to think what ethical practice really look like in the real world. So one of the biggest challenge that what we have faced as a group was managing the ethical issues involved in working with the young athlete. As Rachel, as she is 10 years old, so first of all, there will be a constant confidentiality and safeguarding. So as in this case, the major challenge was to remain in the boundaries of ethics. Like ethics was a checklist to do, like what we have to do and what we do not have to do. And we realized that working with a young athlete, and as she was brought by her parents to the consultancy. So first of all, managing a confidentiality was a challenging one to as a group. So and the other major challenge was that as she was brought by her parents to consultancy, so draw a relationship between these two was a problematic too, as working on this case study. So like first of all, we just divided over parts, like who is going to do this part, like who is going to this part. But at the end, we decided that these are linked together, and these are back and forth, because as the ethics are the fundamental in this case, and we just know about the ethical practice, how they really look like in that. So our group philosophy so we decide. So another challenge was the group philosophy, how we decide our group philosophy by remaining in the boundaries of ethics. So we develop our group philosophy by remaining in the boundaries of ethics, like we do not want to change his behavior, and like we do not allow him to do it like exercise. So this was the other challenge that we have faced. However, we choose a positive and constructive approach, as this approach allow us to do a scientific evidence with client-centered approach for focusing on Rachel voice, and choices are central. And then finding a literature was a difficult too, but we emphasize it by using a 5P model. So we emphasizing it by using a 5P model. So using a 5P model, like we have choose 5P model, like it will be presenting that what's happening now, predisposing what is vulnerable to this athlete, and also predisposing that what happens and what emotions are ongoing. So it really help us to do. So the 5P model really help us to tell her to do mainly focus on the case study. So then there was a lot of logic and reasoning behind this 5 model, and we organized that Rachel was a shy and quiet, so we need some method that will not overwhelm her. So we have to be very careful about our language and avoid leading questions. So so we use a semi-structured interviews and also appropriate questions allow to gather some meaningful information. So it was a challenging too. So was gathering information from the need analysis, that how we do our case formulation as a group. We decided to appropriate to ACT, which is an appropriate approach, would be aligned well in our philosophical stance. It aims to change it aims to change client behavior in private events. So another major challenge was that it aligned well with our philosophical stance as it aimed to change client behavior. So the lessons which we have learned as a group, how closely linked ethics, need analysis are, and case formulations are. So overall, this case study help us to develop a better understanding what ethical practice look like in a real world and how client-centered practice look like.
Thank you very much for listening.